Hello! In this module, we will be discussing hypertension, which is commonly called high blood pressure. Disclaimer: all content and information in this video is for informational and educational purposes only. It does not represent the views of OUHCOM and does not establish any kind of educational mentor-client relationship. What is hypertension? Hypertension is a disease in which someone has abnormally high blood pressure. A high blood pressure means that your heart is working harder than normal. Generally speaking, high blood pressure is a reading higher or equal to 130/80. If you need more information on how to read these numbers, see our video on Introduction to Blood Pressure. Here's a quick refresher from our Introduction to Blood Pressure video. On the left, you will see two numbers. The top number, or 120, is known as the systolic blood pressure, which is when the heart is pumping. The bottom number, or 80, is known as the diastolic blood pressure, which is when the heart is relaxing. Here's a chart of different levels of high blood pressure that your doctor may use to categorize your blood pressure. It is important to note that you will need at least 2 different measurements and 2 different visits in order to fit into a certain level. A normal blood pressure is a blood pressure reading that is less than 120 on the top and less than 80 on the bottom. An elevated blood pressure is between 120 and 129 on the top and less than 80 on the bottom. Stage 1 of high blood pressure is 130 to 139 on the top or 80 to 89 on the bottom. Stage 2 of high blood pressure is a blood pressure reading that is more than 140 on top or 90 and above on the bottom. A hypertensive crisis can be an emergent situation. Please speak with your doctor immediately if you notice that your blood pressure is above 180 on the top or above 120 on the bottom. Next, we will discuss the symptoms of hypertension. Very often, people with hypertension will not experience any physical symptoms. This is why it is important to have your blood pressure checked at every doctor's appointment. However, some people may experience symptoms. The symptoms of high blood pressure can include headaches, chest pain, dizziness, difficulty breathing, nausea and vomiting, blurry vision, feelings of anxiety, and an abnormal heart rhythm. Risk factors for hypertension include an unhealthy diet, lack of physical exercise, smoking tobacco, alcohol use, obesity, family history of hypertension, like if your mom, dad, sibling, or grandparents had hypertension, high stress or anxiety, being over age 65, and other diseases like diabetes or high cholesterol. Complications of hypertension can include chest pain, an irregular heartbeat, eye problems, an aneurysm, which is a problem with the blood vessels in your brain, heart failure, stroke, heart attack, kidney failure, and sexual dysfunction. Time for a checkpoint. What is one complication of hypertension? Complications can include chest pain, irregular heartbeat, eye problems, aneurysm, heart failure, stroke, heart attack, and sexual dysfunction. So, what do you do if you have been diagnosed with hypertension? The goal of hypertension treatment is to lower your blood pressure so that your heart does not have to work as hard. By lowering your blood pressure, you will also reduce the risk of developing complications. Lifestyle changes are a very important part of hypertension treatment. These can include changing your diet to be low in salt and high in fruits, vegetables, lean protein, and healthy fats. Another great way to help lower your blood pressure is to increase your physical exercise. Stress and anxiety can increase blood pressure, so taking steps to decrease these feelings is important. Tobacco and alcohol use can also increase your blood pressure, so decreasing your intake or quitting altogether can help treat hypertension. If lifestyle changes are not enough, medications can be prescribed by your doctor to lower your blood pressure. It may be a good idea to keep a home blood pressure log to show your doctor at each appointment. You can ask your doctor how frequently they would like you to take your blood pressure at home. Let's recap what we've discussed. First, hypertension is a disease in which you have an abnormally high blood pressure. Many people may not experience any symptoms of hypertension, but those that do may have headaches, chest pain, dizziness, blurred vision, or an abnormal heart rhythm. It is important to treat hypertension to reduce your chance of complications like heart attack or stroke. Treatments for hypertension can include lifestyle changes and medication. Thanks for watching. We hope you enjoyed this module.